So this week, you brought something pretty significant to my attention, and that is this concerning kind of a jump in measles cases that we're seeing across the U.S.
Yeah.
And we're talking at the early part of 2025, and you shared with me both a news report and like a little briefing document that kind of summarizes it.
Mm-hmm.
Our mission, if you will, for this deep dive is to understand what exactly is going on with this outbreak and to explore the potential reasons behind it and, of course, what it all means.
Right.
And right off the bat, one statistic that stood out to me was that we're seeing nearly 500 confirmed cases across 20 states already this year.
Wow.
Compared to just 285 for all of last year.
Yeah, that's a huge increase.
So what is going on here?
Well, certainly it's a striking increase. That warrants further examination for sure.
Right.
And the data as we have it right now indicates 483 confirmed measles cases have been reported nationwide so far this year. And as you mentioned, this is not limited to just, a small area. These cases are spread across a significant portion of the country. We're talking about 20 states plus New York City.
Right.
Which reports separately.
Right. And just to list them out, we're talking about Alaska, California, Florida, Georgia, Kansas, Kentucky, Maryland, Michigan, Minnesota, New Jersey, New Mexico,
Wow.
New York City, New York State,
Yeah.
Ohio, Pennsylvania, Rhode Island, Tennessee, Texas, Vermont, and Washington State.
Yeah.
It really is a considerable geographic distribution.
It is.
Now, even if the numbers in those states are relatively small.
Right.
But, the briefing document really zeroes in on one state in particular as sort of the heart of this whole thing.
Yeah, Texas is unequivocally the epicenter of this current outbreak.
Okay.
The numbers coming out of Texas are quite alarming. As of March 28th, they've reported 400 confirmed cases of measles.
Wow.
So a single state accounts for the vast majority of the total cases that we're seeing nationally.
Yeah. I mean, 400 out of 483, that's a huge concentration.
It is.
And, the news reports that you shared with me, they use the phrase lethal consequences when talking about the outbreak in Texas.
Mm-hmm.
And that's a phrase that, obviously carries weight and causes concern.
Absolutely. And unfortunately, the data nationally also reflects that, the severity that's indicated by that phrase.
Okay.
Across the country, 70 individuals have required hospitalization due to measles complications this year.
Wow.
And sadly, there has been one confirmed death directly attributed to measles and an additional suspected case that's under investigation.
Yeah, those numbers are definitely sobering.
Yeah.
Especially when you consider, that measles is a disease that we have a very effective way to prevent.
Yeah.
And that kind of leads us to what seems to be like a key element to understanding this whole surge.
Right, exactly. The data really points to one significant factor, and that's vaccination status.
Yeah.
Of those affected, CDC data indicates that 97% of the confirmed measles cases this year involve individuals who are either not vaccinated
Wow.
or whose vaccination history is unknown.
97%, that is such a high number.
It's an incredibly high correlation.
Yeah, it really suggests that, this is impacting people who aren't protected.
Yeah.
And it's not just adults either.
Yeah.
I mean, the report highlights that 75% of these cases are in individuals under the age of 19.
Right.
Which really kind of emphasizes, how vulnerable younger populations are in this.
Absolutely.
Right?
Yeah. And looking into where this outbreak likely originated, the information that we have suggests that it began around late January in the region spanning the Texas-New Mexico border.
Right. And, in the report, it mentions Lea County in New Mexico.
Right.
Which had 44 cases as of late March.
Yeah.
And that number actually increased even a little bit over the course of just a few days.
Wow.
And what's really interesting to me is that it's right next to Gaines County, Texas.
Yeah. Yes, Gaines County is sort of considered the central point, the initial spark, if you will, of this outbreak.
Right.
So their close proximity combined with the timeline of reported cases strongly indicates that there was a spread across the state line in the initial phase of this outbreak.
And, the briefing document that we have here kind of touches on a factor that, often comes up in these discussions about measles outbreaks. And that's this idea of vaccine hesitancy.
Right.
And it's a complex issue.
Absolutely.
With many contributing factors.
Yeah.
And it's important to look at it objectively based on the information that we have.
Precisely. And the report really presents this information factually.
Okay.
It points out that federal health officials have in the past linked measles outbreaks to instances where parents have chosen not to vaccinate their children.
Okay.
And this is a conclusion based on extensive public health data
Right.
and broad scientific consensus.
The report also mentions U.S. Health Secretary Robert F. Kennedy Jr.'s acknowledgement of this outbreak
Yes.
in Texas.
Hmm.
And it's interesting to note that someone who has previously voiced skepticism about vaccine safety is now publicly recognizing the impact of this outbreak and offering federal resources,
Right.
including vaccines, to help address it.
It is an interesting development.
Yeah, the report also brings in another dimension to this conversation by referencing a New York Times article.
Yeah.
And this article details some pretty concerning cases of children who suffered liver damage
Oh,
after being administered unsupervised high doses of vitamin A at home.
wow.
And the connection that's drawn here is that this practice of using high doses of vitamin A as an alternative to vaccination or medical treatment
Mm-hmm.
is associated with individuals and groups who express skepticism towards vaccines,
Right.
including figures like Kennedy.
Yeah,
So that's a worrying potential consequence
it is.
of, beliefs that run counter to established medical guidance.
Yeah, it is concerning for sure. It underscores how well-intentioned but ultimately misinformed advice
Right.
can have serious and harmful consequences, especially when it gains traction among those who may already have doubts about conventional medical practices.
Despite these pretty concerning figures
Right.
and this clear correlation with vaccination status,
Mm-hmm.
the CDC issued a statement in early March that the overall risk for widespread measles across the U.S. remains low,
Okay.
which seems a bit counterintuitive at first glance.
It might seem that way, but it's important to understand how public health agencies like the CDC assess risk.
Okay.
They're constantly monitoring disease patterns and considering a lot of different factors, including overall vaccination rates within the population,
Right.
the capacity to contain localized outbreaks through, public health interventions,
Right.
and the specific characteristics of the virus itself.
Okay.
So while this surge in cases is definitely significant
Right.
and requires attention, the assessment of a low risk for widespread national transmission suggests that they believe that current measures and overall immunity levels outside of these specific outbreak areas are likely to prevent a nationwide epidemic.
Okay, so that's good. That helps give it some context.
Yeah.
And finally, the briefing document clarifies that the 483 cases that we've been discussing are specifically confirmed cases.
Right.
Apparently, the CDC is also tracking probable cases
Yeah.
that haven't yet been confirmed.
Right. That's an important distinction to make.
Right.
Confirmed cases are those where the presence of the measles virus has been definitively established through laboratory testing.
Right.
Probable cases meet certain clinical criteria, so meaning, the symptoms and the presentation strongly suggest measles,
Right.
but they haven't yet undergone that final laboratory confirmation.
Okay.
So that means that the actual number of individuals affected by this outbreak could be higher than the currently confirmed figure.
So as we kind of piece all of this together, what are some of the key insights that stand out to you?
Well, the primary takeaways here, I think, are the significant and rapid increase in measles cases in the early part of this year,
Right.
the clear concentration of this outbreak within Texas,
Hmm.
and the overwhelmingly strong association between these cases and individuals who are either unvaccinated or have an unknown vaccination history.
Right.
We're also seeing a disproportionate impact on children and adolescents.
Yeah.
And the serious consequences of this outbreak are evident in the reported hospitalizations and the tragic death that has occurred.
Absolutely. I mean,
Yeah.
I think that 97% figure is just so striking.
It is.
Not only because it means, the people getting it weren't vaccinated,
Yeah.
but really paints this picture that the virus is almost exclusively finding hosts within this specific demographic,
Yeah.
which really underscores, the protective power of vaccination
Yeah, it really
for
does.
the vast majority.
Yeah.
You know?
It paints a stark picture
It
of the
does.
situation.
Yeah. Considering these numbers and the information surrounding vaccination, what further questions does this raise for you about how information about health is shared and understood in our communities?
Well, it certainly prompts us to think about, the interplay between individual choices
Right.
and the collective well-being of the public,
Yeah.
and the very real impact that misinformation can have on those decisions.
It really does.
Yeah.
It brings to the forefront these important questions about the most effective ways to communicate the importance and safety of vaccination
Right.
and how to address, the underlying factors that contribute to vaccine hesitancy
Yeah.
and how to navigate that balance between individual autonomy and, the responsibility to protect public health.
Absolutely. And if you'd like to explore this topic further, the CDC's website and your local health department are excellent resources
Yes, they are.
for the most up-to-date information on measles and vaccination.
Thanks for joining us for this deep dive.
Thank you.
We'll see you next time.
See ya.
Bye.